Now, your new orthopedic surgeon does things a little different. He's more of a sports guy, so he does do things a little different than kind of your other orthopedics. He had a few demand of a couple common trays that your younger surgeons do things just a little different. This guy does it a little bit kind of more like the gold standard, so it's kind of old school-ish type, so you don't have a lot of those instrumentation, so we bought some of those. So I'm gonna just kind of lay them out. You guys can feel free to ask questions. I don't know if I'll go through each individual thing off each tray, but I'll try to do kind of the best I can to kind of keep it in the time frame. You guys may have more questions that you want to know about it other than. One of the biggest things that's different is the ACLs, the way he does ACLs versus your other guys doing ACLs. He will take he does a VTB graft where he does the patients. It's a much less expensive way. So the way that other guys do it, they have to buy a $3,000, $4,000, $5,000 graft, come in, it's usually a quad or something like that, and then put it in. Dr. Boden does it a little bit different. So it is much less expensive, but you have the instrumentation for it, so it'd be kind of new. So you're drilling tunnels to kind of shuttle bone blocks and tendons through. Any questions about the ACL or the tray or that he does? I don't know how many we'll do up here.
So it'll just come from the patient?
Yeah, yep. They take a bone block here, bone block there, take a middle third of the patella tendon, take it out, put some threads on it, then wire it back up and put it right where it used to be. But yeah. Much less expensive way, and it kind of is the gold standard they do. There's probably about half of them done that way in Knoxville. The new style kind of is to take a quad because it's a little bit thicker. We really don't know what that does to the quad later on in life. You as a young person would be fine, but people usually pop their quads around their 50 or 60s, so, but it is the new sexy kind of style of trying to do it. The other thing too is trying to get and do it that way. Instead of hyperflexing the knee, you can use curved drill bits and guide. That's kind of the biggest difference. So that's what's kind of cool. Our set's called the Clancy set, so you can get curved pin and curved drill guides and bits. Any questions about ACL or the ACL trays? Nope, this is going to be really super easy. Oh yeah, please look at it. Yep. We may end up converting some of these together. These are measuring just to measure the bone block to see it's 7/8, 9s. Straight bits. That's the curved pin, so you will put the, See, I don't know, she's giving me it's 90% of the time, so you figure.
Yeah. So it'll be these two trays?
Yes. Unless we end up kind of merging them two together so you have fewer trays, those are so few items that it may be better just to put them all in one tray. Great question, not sure. You may have one here, two down there. You've got 3 total of each, so exact same tray. Okay. Yep. The question on the case medic, they live here, down there at BMOS. I don't know how that's going to go. That's not my pay grade. I'm assuming maybe 2 down there, 1 up here, something like that, somewhere along those same lines.
So is he gonna do them up here?
I don't know.
It'll be patient.
Probably few and far between.
Yeah.
I guess I'm sure between the up to the patient to see.
Cause I mean, I have not ever done one. They don't normally do it up here, so like if it does come.
Yeah, I think they just did one here last week when they shut BMOS down.
Yeah.
Remember the low
They did.
census?
I was gonna say, it would have been ideal.
Yeah. So, but answer your question, most likely they're all gonna be down there.
Because we'll have those patients who are sicker than others or have a large BMI or something like that that will need to come up here that are not BMOS appropriate.
I did kind of fit. There's also a graft prep tray. So this is where he'll put the. You guys probably seen or use this. This is where he'll prep the graft. He'll cut and make his holes and stuff. So that's what this tray will be for. So it may, but we'll consolidate it now to 2. That's it. No questions. Something else that can be used during ACLs are compaction pliers. These things you probably haven't seen or used before. They're pretty cool. You're taking bone blocks out of the tibia and the femur. They're usually jagged. They can run through and kind of trim it up. Well, these things are nice. You can kind of stick the bone block in there and pinch it, so you're compacting the bone and then getting it round. So these are called compaction pliers. You're gonna have a couple sets of them, and they're real nice to do it on each bone plug, so you get a nice round plug to slide.
So you don't have to ronger.
You do some, but you won't do as much because you'll use these, and then it makes it perfect.
Nice.
So that's what these things are called, compaction pliers. You got bird beaks. You guys have seen those. Meniscal root repair tray. You all have one of these. There's a loaner tray that you guys have that's here. You don't do many root repairs. I don't think you've done any up here. So meniscal root. It's a little different than taking the fast fix and doing the meniscus. This is, you have to kind of drill a tunnel, kind of like an ACL tunnel to try to tack it down. But this is what that meniscal root repair tray will
Is that
look
through a
like.
scope?
It is. Yes, ma'am. In case someone wants to see it.
What was that question?
Is it through a scope?
Through a scope,
Yeah,
okay.
it's a procedure, it's scope.
This is an old school device. It's called a meniscal stitcher. This is called a inside out meniscal repair device. So when you repair the meniscus, typically today everybody does all inside with the fast fix. You can do outside in or inside out. These are like little bullets that
The
you'll,
one with the really long needles.
yeah, it's like a really long needle, then a thread and a really long needle.
Yeah.
And you put this right in the meniscus where you want it, then slide this big needle through it, and then you take the other one, slide it through it, then you pull it out the back of the knee, and then tie it down. So it's just in some cases where you can't get to or see access. You guys never had one of these. It's not used that much. Pretty much every account everywhere has one that's probably been there 30 years, and maybe use it once a year or something like that. But
Yeah, that's what I want.
it's been a while. But these are
Oh.
Menisco City. Michael and Dave did it. So that's what this is. Again, you may not see it very much, but that's what is called a meniscal stitcher device. There's another company called Zone Specific. Sometimes they use those two words interchangeably. Any questions about that? I'm moving fast for you all, but make sure I don't move too fast. We'll do that one. Shoulder tray. This is a pretty generic shoulder tray. It's got your typical things that are in there. There's cannula drivers, mallets, awls, bird beak, suture cutters, suture graspers, tissue graspers, elevators, rasps, crochet hooks, switching stick. It's kind of the basic generic one. You guys, for scope as well. Yep. Yes, ma'am.
Going back to the graft, that's for scope too.
All of this is.
All of
Yep.
it. All of it.
Everything.
Besides
Yes.
shoulder, obviously.
Well, yeah.
No, that's a scope.
Scope also.
Oh, okay.
Yeah, all
Does
this
he have
stuff
his
is
own
scope.
like
Everything's
basic tray?
Okay.
Is he gonna have a basic tray
No,
for
ma'am.
himself for basis?
No, ma'am, but he probably is the only one who will use these ACL ones because the other guys do the technique a little different. So those would kind of be for him, but there's not really a shoulder tray that's for him. Any questions on that? This is going pretty easy.
I've never seen that stuff before in my life.
Oh my gosh.
I haven't again, so.
It's old school.
All right, how about this hip tray? So you now have a hip instruments tray. A hip instruments, we call it hip instruments. Kind of catchy.
Smith and Nephew? I need that.
Yes.
Yeah, this is hip scope stuff.
It's
all scope.
Show me that.
She wants to know what's gonna be done to her.
Oh,
Maybe.
you're having it?
Maybe.
Oh,
Maybe.
maybe.
We'll see.
These things will suck inside you. They're really long. This is basically your shoulder tray. It's just much longer. That's it. You got the same suture grasper, suture cutter, crochet hook, switching stick, knot pusher, bird beak.
So
It's-
some of the stuff is similar to like what is on the shoulder, or y'all's shoulder thingy tray?
This shoulder tray is very similar to the stuff you have on your shoulder tray. Yep. In fact, on yours, you've got a lot of our stuff on there. You also have a lot of ConMed. You have some Arthrex. You've got a hodgepodge of stuff. This shoulder tray is pretty much all the same instruments. It's just all my stuff. but it could be used interchangeably.
If he comes up here, you're gonna be our rep?
Yes, ma'am.
Okay.
Either me or Barrett. Either Barrett or I will be the ones coming up here. There's a few layers to this tray. That's just the cannula driver. It's 110 millimeters versus 72, just gets a little bit longer. And then there's really long curettes and really long microfractures picks in there. This is the sled, yeah. Most people may not have worked with this one. This is just a sled in the hip. Instead of putting a cannula in, that's you can have a portal and slide this in there, and then you slide your instrumentation in and out of using a sled.
He uses Arthrex.
Oh,
So that's what this little. So when they
But
ask
this
for
is
the
the same.
sled,
well, it's close enough.
It's all the same.
yeah, there's
I
just
mean,
a
they
different
look-
name right on
yeah.
it. Any questions about the hip tray?
Do we still have our lenses here?
Oh,
I haven't
great
seen a long one
question.
in a while.
I don't know. I have a extra long lens down there
We
for.
did have them here,
You did, yeah.
but I don't know.
I don't know anymore
We'll have
either.
to have lenses if we do endoscope here.
Yeah.
I've not seen him.
Arthrex has, I think theirs is a little longer than their regular ones. For us, we just have our shoulder and knees a little longer, and it's all the same. And then we have extra long scopes. But that is something that's a good point you brought up, is that if you happen to do have a big patient, there are extra long scopes, and you'll have to probably have those in just in case.
We have the sacrifice too.
We do, yep. The shaver blades are down at Surgery Center. And that's a great question too. The shaver blades and burrs connect to your regular standard arthroscopic knee and shoulder ones. Now, with that said, and I wasn't here last week when he did one down there, he likes a curved burr, and the only one that makes that's ConMed. And so I think they were trying to bring the ConMed box in, that ConMed handpiece in. I don't know if they did it, were successful or not, but he likes a curved burr, and that may be the only company to do it. So you may end up having either two handpieces in there or using their shavers and burrs.
Does he, does he do that on a bed attachment down there, or does he do that, we did them on the HANA table.
Mm-hmm. So another great question. He likes the Stryker Guardian table. It's like a postless table. It looks a lot like the HANA table, but it's really big and expensive. But it's postless. It doesn't have a perineal post that you're yanking them and pulling them up against. They used that this last week. I wasn't there, I was out of town, so I don't know how it went. He did get, you all have our bed down there, and so we do have boots and stuff for him to use down there. I think he said he's never done it on a HANA table, so I don't know
I
how
wonder if
he
he's
will.
opposed to it, because that
Well-
bed's huge, we're not gonna roll across the parking lot.
No.
I agree. So I don't know. Stryker brought
We
it
have
in
the
for
big
him there.
post for the HANA?
Huh?
The big giant post for the HANA? It's a bigger post that you use for it.
Oh yeah, I'm sure it's back there, because we used to do it in
I
there.
haven't seen them.
We have a hip distractor down at Surgery Center, and we have the perineal post and that. We also have now what's called a pink pad. It's a real kind of spongy, non-skid traction type pad that goes on our bed that Dr. Morgan was using so that you don't have to use a post. And you can actually lay a patient on there, whether it's heavy or thin, and then pull, and that patient doesn't move and it doesn't shear the skin. So we can simulate it for a whole lot less. But so just know it is here and it's around.
Okay.
Good question for the hip. Maybe you want to show them the hip cases.
I mean, I'd like to learn
You would?
it, yeah. I've never seen them, so.
That's on my tray. So what other questions? I know there's a lot of them. They're all duplicates, but in triplicates. Any questions about the new stuff? No, we'll try to, especially with him being here new, we'll try to always come a little earlier than normal, just to kind of help pull and grab everything and make sure everything's kind of there. We're kind of learning him as well. He does things just a little different, so it's just another difficult, like, all right, let's learn a new way to skin a cat. And at the end, it's still a skin cat. But board cat, but we'll find a way. I know he is getting faster, so that's helped out a lot. All right, Donna, I think that's.
All right, any questions? Anything else? All right, thank you, Gannon.
No problem. I need a picture of that in-service